the body. They are essential in terms of the walking. If you think about a baby uprighting itself, I mean, they make us very, very unique when you talk about the ability to go from a four-legged animal to a two-legged animal. Largely originates at the hips. Obviously, the glute muscles are particularly important towards positioning us in more of an upright bipedal position. But overall, they do connect us to our trunk. They're able to absorb, transfer, and produce force. When you think about sporting events, they're incredibly beneficial and incredibly important for transmitting force generated from the ground, the lower body, up into upper body movements. They're essential for even activities that you think of when it comes to the upper body, such as throwing and hitting. And overall, if we don't do things to prioritize them because of how important they are, you really start to lose options, not just at the hip joint, but with regards to doing other things, whether or not it's activities of daily living or some of the sporting tasks that I referenced. A lot of times when people think about joint health and hip health in particular, they automatically think about flexibility. But what I want you to think about today is the three words: access, control, and tolerance. So common hip complaints that we see at Rehab to Perform are, this is not meant to be an exclusive list at all, but anterior hip tightness or pinching with squats or lunges, or anything really where you're folding your body forward. We will hear about lateral hip pain with walking, running, or lifting. A lot of times this could be described as kind of a hip bursitis or an IT band type of syndrome. And then seat bone pain, the ischial tuberosity. If you can think about the bones, if you're sitting with, like me right now, that you are sitting on that are actually part of your pelvis. But oftentimes that'll be with hinging or running. These are relatively common in active adults or common in competitive athletes. And I think one of the most important parts that we regularly have, or I should say important topics that we regularly have with people, is we will talk to them about the fact that just because you're experiencing pain does not necessarily mean that you have damage, and especially not damage that needs to be surgical. If A, not B, if A, there could be certain things going on, but a lot of times it's going to be unrelated to the actual structure itself. Hip discomfort, I want you to think about it as a signal. And really, you should think about this with any area of the body. Symptoms are symptoms. Symptoms are meant to create awareness in you, the individual, right, the organism, to do stuff differently. And in a situation where we are having hip discomfort, you should not necessarily be attaching yourself to a diagnosis, especially if you potentially received an MRI. You could have imperfect hips. You could have hips that don't look the way that they did when you were 12, but also be in a situation where you have high functioning hips. If we just look at a lot of the literature surrounding hip labrums, a lot of high-level athletes who are asymptomatic will have MRIs that do not look picture perfect. So again, this leads us back to us focusing more on movement health and focusing on gaps that we might have in terms of movement competency, strength to weight capacity, which we can call relative strength, load tolerance, yes, range of motion. But the key message here that I want you to think about and really carry with you is that pain is rarely the start of the story. It is often the end. And really, that's the end of a journey that may have transpired and led you down certain paths that, okay, the end of that journey becomes, now I'm aware that I need to do something about it, and you're creating a new story. The hip is designed to do flexion extension, which is moving forward and backwards. If you can think about bringing your knee forward up towards your chest or taking it backwards behind your body if you were standing, or if you're watching a walker or runner have their leg go behind their body into that push-off position. Your hip needs to do what is called internal and external rotation. If you were just standing and you were toeing in, that is internal rotation. If you were standing and turning your toes out, that is external rotation. In addition, You could have abduction or adduction. So if you think about a snow angel, if your feet are going out away from one another, that is abduction. Adduction is you bringing your feet towards each other, towards midline. Hips are also important to, it's also important for them to be able to accept load. If we talk about just moving from 2 legs to 1 leg, we're accepting our body as a load through 1 leg, as opposed to 2. It's no longer shared. And then really a big thing, especially when it, not just from a sporting standpoint, just from a life standpoint, we need to be able to accept force. We need to be able to create force. We need to be able to put ourselves in position where we have capabilities that allow us to really navigate the equation of mass and acceleration. So, force equals mass times acceleration. If you can think about just stepping off of a step, there is a force that you have to overcome to not, mush yourself into the ground like a bowl of Jell-O. If you were standing on a box and maybe stepping off and jumping to the ground, your body has to create a certain amount of force to kind of counteract you being potentially too compliant and falling. We also think about force production, traditionally speaking, with any kind of jumping. So whether or not you're jumping forward or jumping up, there is a force production, and the hip is incredibly important for those. But overall, your hips need range, they need strength, they need coordination, they need more than just you stretching them and having the ability to get into positions. Modern life can challenge hip health. Prolonged sitting could put you in a situation where maybe your body just naturally accommodates. This is obviously with, very, very long periods of time with work and leisure activity. If we're working for 6 to 8 hours in a chair, we're then going home and spending an additional 6 to 8 hours on a couch, potentially on a Saturday or Sunday, watching too many sports and not being active. Your body will accommodate. It will lose options. It will lose capability. Repetitive training can potentially narrow your movement strategies. This is where we recommend making sure that there's enough variety to make sure that you are not only having those options, but actually exercising through those options, and really making sure that we're chasing intensity without potentially getting us outside of our capacity. That would put overload on tissues, on joints that might not be sustainable. But at the end of the day, really, we want you to remind yourself, if you don't train variety, if your body doesn't have variety, if it's not exposed to variety, your body oftentimes is going to lose options. And losing options is a recipe for potentially having problems. Movement efficiency is life efficiency. A lot of times people will talk about VO2 max, especially as a lot of people are kind of on this longevity or health span train, which I think is tremendous. VO2 max is looking at energy efficiency. How well does your body utilize energy? Hip competency or efficiency through the hip is traditionally going to be looked at as a way of having mechanical efficiency. If you have inefficient hips, it's going to take you more effort to do things that involve your hips. So things like squats, deadlifts, lunges are going to potentially put us in a situation where we're using our hips to exhibit efficiency with our body that is ideally going to transition to life efficiency. For our runners out there, you often hear about running economy. What's my overall level of economy with self? Oftentimes we can look at that through a double leg or a single leg lens. But overall, inefficiencies could potentially allow me to accumulate more joint or tissue stress. It could put me in a situation where I'm fatiguing quicker because I'm not as efficient with moving myself, and overall put me in a situation where I have less tolerance. If I have less tolerance, I'm probably going to also be less likely to move. But the big thing for you here, daily life shouldn't feel like a 1 rep max. You should have a certain amount of capability, that you have a buffer zone between what your bottom level is and then what you could potentially be asked to do on a regular basis. Simple hip self-checks. We're not getting into a situation where we're going to talk about testing names. We're not going to talk about special tests. Big things you could do here. You could lie on your back and you could pull your knee up towards your chest. You could look at doing that on both sides. You could be in a situation where you're lying at the edge of your bed and you're also pulling your knee to your chest. And a question for you there is, can your foot still interact with the ground? So potentially sitting on the edge of your bed, keeping your feet on the ground, lying back, then pulling your knee to your chest. If you pull your knee to your chest and your foot elevates off the ground, you could potentially have challenges or issues with hip extension. Something to look at would be shin box 90-90s, or being in a situation where you're able to internally and externally rotate. That's potentially an opportunity for us to send out a video after we get done with this, and you get your follow-up email. But really a big thing there is you're looking at relative symmetry. They don't have to be perfectly symmetrical, but those items there should be relatively symmetrical. I'd also argue that if you put yourself in a situation where you're just sitting and taking your legs out into a straddle position, you should feel like you have relatively similar flexibility, and the end feel, the stretch or the pulling sensation that you feel should be relatively comparable. Other things that you could look into is balancing on one leg and then reaching down towards your foot. That would be a single leg balance reach. That would be using flexion and extension on one leg. Are they relatively similar? Can you get to relatively the same distance? Do you have relatively the same ability level? Could you also stand on a chair and do a single leg squat into the chair and stand up out of the chair? That would be another way to look at single leg hip capability that's also integrated and combined with other joints. And then putting yourself in a situation where if you do have any kind of symptoms, do your symptoms change with warm up or movement? I would argue that if they change with warm up or movement, that you should be of the benefit that that is something modifiable. If all we did was increase tissue temperature, we increased circulation, and those symptoms that we were feeling are automatically feeling different, well, we're not looking at that as being a joint change, because your MRI is not going to change if you're warmed up versus not warmed up. There are certain things going on that lead you to believe that your hip might be benefiting from certain things if symptoms change, not warmed up versus warming up. Because again, that image, that static photo of your hip joint itself didn't change. But big thing here, awareness is the first intervention. If you have more awareness of what your body can do, or awareness of what your body should be able to do, this should put you in a position where you can do more to change what it is that you're doing on a regular basis. For the advanced level group, I would argue that things like single leg planks and Copenhagen planks would be even higher levels of you doing an assessment on your hip health. Those are isometric tests, which in particular are going to address your capabilities through the front of your hip or the inner part of your hip. And then something that many people are familiar about that you could also do is you could do a single leg bridge. And that would look more at the isometric tolerance of you to do something involving hip extension. Things to think about when you have symptoms as well, outside of just the fact that you can do a warm-up, is that a lot of times modification goes a really long way. And if you can modify activity and put yourself in a position where your symptoms change, you shouldn't be in a rush to stop. And you should definitely be more of the mindset that you are more capable and probably don't need to tag in somebody else. Dials that you could potentially change, and these are variables, include range of motion, load, volume, intensity, frequency, speed and tempo, exercise selection, stance and setup. This is a tremendous list for you, honestly, to be using for just about anything. If you are doing any kind of training, whether or not it's body weight or with weight, these dials are really, really good to help you really fully embody a principle that we value, modification being better than rest. Modify being better than rest in action. A couple examples here is reducing depth instead of skipping squats. I also, instead of reducing depth, could be sitting to a box. So instead of me controlling the change in my body going down and up, I'm using a box to kind of help me do that on a consistent manner. Slowing the tempo down instead of removing weight. I also could remove weight and reduce the load. So there I'm changing tempo and weight. I could go from bilateral to one leg. Sometimes that can help me, or I'm doing a single leg exercise and automatically going to two legs. Things feel better. I also could swap high impact activity for more controlled patterns. Sometimes something simple here is instead of running, maybe getting on an elliptical or a bike. But overall, putting yourself in a situation, potentially there's more stability or there's less of a leaving the ground element to whatever it is that you're doing. But the message here is that smart modification can preserve momentum around your training and overall allow you to continue to either maintain certain levels of confidence or to continue to build on it. Active recovery is something we always recommend, regardless of your symptom profile. And I'd say almost 99.9% of the times, productive options when hips feel a little bit off are going to be walking, controlled mobility flows, or for anybody who's familiar with cars, or controlled articular rotations. You can potentially look those up. Isometrics, which I have mentioned, planking variations, Copenhagen plank variations, bridge variations are really, really good. You just hit three areas of your hip there. If I added in a side plank, I would hit the fourth and final hip isometric that I could do. I could also do low-level strength work. I could be doing things such as wall sits, in addition to just basic body weight sit to stands. Sometimes sled work is really, really well tolerated, especially with no weight, just doing marching. I also could do certain breathing and positional resets, sometimes putting my body in a better position, a little bit more relaxed, especially when we talk about the relationship between our sympathetic and parasympathetic nervous system and the impact that breathing can have on it. But at the end of the day, active recovery is going to be better than rest. Some level of recovery-based work, and if we look at recovery-based work as just being a lower level of training, is often a lot of times better than just resting. When to stop self-managing? Really, this is a combo approach. If you have dials and variables that you're modifying and symptoms continue to worsen, I would say that's an opportunity for you to tag somebody in. If you have pain that is on your mind and it is bothering you and it's really consuming you for greater than let's say 2 to 4 weeks, tag somebody in. Night pain, sharp catching, giving way, something that makes your face grimace is often a great opportunity to tag in. And when I say someone, you're either tagging in a physical therapist or an orthopedist. And overall declining levels of performance. If you're looking at certain variables from a performance standpoint and you see them declining, you are losing an element of conditioning or at least adaptation that your body has achieved. And that certainly is not something that you should take lightly, especially if you are somebody that has had more birthdays where you losing your baseline can be a little bit more impactful. Something to continue, to always remind yourself is, seeking help is not weakness. It's just taking ownership of a problem. And if I get on top of this sooner rather than waiting months and potentially years, I'm probably going to be able to get back to what is that I'm doing quicker, as opposed to potentially having a significant course correction that is needed as a result of neglect. Building a better baseline. Again, we always think about this when we talk about the phrase movement health, competency, capacity, conditioning. At the end of the day, we are trying to create more capability. But hip health is not necessarily about fixing one thing. It's about raising your floor. It's about options, which is range of motion. It's about tolerance, which could be built up through a wide variety of those different variables that I mentioned earlier. And the big thing with your baseline, it's not just a physical baseline, but it's a mental and emotional baseline. Part of training is also having adequate recovery, not just passive recovery, but active recovery. And I would be remiss not to mention that sleep is the single most important thing when it comes to the word recovery. But at the end of the day, if you're of the belief, like our team is, where we want to embody be greater than yesterday, a lot of that starts with a better baseline and taking ownership of creating a better baseline for yourself. Rehab to perform exists, and how that fits in with the hip health side is, we bridge this gap between rehab and performance. So when people do need hip rehab, we get them back and we build this foundation for them to have hip performance. Hip rehab, hip performance, body rehab, body performance, whatever kind of way that you want to bucket that. But we are the fitness forward healthcare version that a lot of times active people are looking for. And the goal is, again, not just necessarily that pain management side of things, but we want to position people where they have the information they need to live life differently, and they're creating a better baseline for themselves. That largely comes as a result of us educating them and working with them as a coach and consultant so that the individual can apply the education that we are looking to expose them to. And again, a further reminder there that pain management is a part of what we do, but it's not the whole thing. It's not really the overarching mission. We're of the belief that if we create a more capable body, you're going to not have to worry about, the word pain as much. Your body is not going to need to create awareness for you to do stuff differently because you're already doing it yourself. And ideally, put yourself in a situation where you are future-proofing your body, you're increasing health span, increasing longevity, increasing your body efficiency, making you more likely to move, and ideally that impacting your life in a wide variety of different ways. But the goal is not to just reduce symptoms; it's to help you understand your body, take control of it, and put yourself in a situation where you're able to live life to its fullest capability and to ideally perform for life. In closing, you're in control. You're entirely in control of hip health and the things that you're doing on a regular basis. Your hips are not fragile. They took you from being a four-legged individual to a two-legged individual. They're incredibly strong. They transfer force at incredible amounts that allow us to do a wide variety of amazing things at various points in time during our life. When you think about it, especially the sports world, you have the different dials to turn. I think I listed 8 bullet points there. And you have a ton of different options to change those variables before potentially stopping. At the end of the day, you don't have to walk that path entirely yourself. You can tag in your friends at R2P or potentially an orthopedist. There are people out there that want you to continue to move, to want you to continue to do things you love doing. And I always err on the side of tagging people in earlier rather than later. But a big picture thing to remember yourself is that with education, ideally you are more empowered, and empowered movers are able to perform longer. And that does tie into, again, today's popular societal discussion surrounding the word health span. And if you're not familiar with health span centers around the belief that it's not just important that we live a long life, but we live an active life, and we're making the most of our years, not just having more years. With that being said, we're wrapped up. For the 25-minute mark, I've got time for some Q&A, and would like to, open the floor.
Dr. Funk, this is Latosha. Thank you so much.
Absolutely.
I really enjoy these sessions. You don't know how much I get upset when I have to miss one. Really much appreciated. I really appreciate you emphasizing, education, empowerment, in order to evolve. And so my question to you is, I often struggle with building, as I call it, my health dream team, right? RTP is definitely there, right? I have my chiropractor. So what I would like to hear from you is tagging in the different professionals, right? Because everybody has their clear swim lane, right? But then some lanes get blurred, right? Because some have cross-cutting expertise that fall into other lanes. And so what I struggle with is, okay, when do I engage with RTP more, right? Versus my chiropractor versus, XYZ. So I would love to get your insight as it relates to hip health and everything else. When to do what or who to go to for what.
Yeah, that's a really tough question, because I think the hardest part there is not all physical therapists are one size fits all. Not all chiropractors are one size fits all. I think that goes to learning about the professions themselves, but really learning the professional. So whichever professional that people are working with, I think it's important educating yourself on what matters to you, what has worked for you previously. Ideally, people who you work with take a big picture approach. They learn you, they take the time to get to know you as an individual, and they work through plans and processes that are relevant to you. So I hate to be dismissive there, but it's probably a conversation that can go in so many different directions. I think the biggest part of it is the relationship development side, because again, I went to PT school with 60 people in my class, and we are all a little bit different. So it would be hard for me to safely say to go to a PT if this or a chiro if this, especially knowing that, at least in my opinion, a lot of the good chiros and PTs are probably doing things more similar than not. And there's probably a pretty significant Venn diagram overlap. Whereas I could speak for physical therapists in the profession that I'm in, and there's no overlap, where we have very, very little in common. So I know that's not really an answer, but that's at least me being honest.
Thanks, I appreciate it.
Anybody have questions as it relates to hip health, the presentation as a whole, anything that you might currently be experiencing or maybe you could get additional advice on?
Dr. Funk, this is Latosha again. I'm going to hop in. I am your perimenopause, menopause woman that loves to come in with questions focused on us ladies. So once again, hip health as it relates to women as we're progressing through the various stages. So for example, visited my chiropractor. He did a scan of my hips, came back, hey, everything's great. Keep doing what you're doing. Let's continue with the manual adjustments. As it relates to hip health in women as we're going through these stages of perimenopause, menopause, can you speak to, is there anything different that we should be focused on? Any additional tests that RTP, I want to focus on RTP in particular, that will fall out of your wheelhouse to be conducted that we should be aware of or do more research on? So in this education of us women of a certain age, any tips, tricks, or advice?
I just have probably more advice as it relates to people that just are having more birthdays in general. And I would say that a big thing to continue to think about is you being efficient with yourself from a movement standpoint. It is very important that we have body weight efficiency, and that comes through being competent with moving ourselves. So the three areas that I love, and this was on a previous presentation, to have people make sure that they maintain the ability to do is get to the ground and off the ground without using your hands, be able to go upstairs without using the handrail and ideally skipping a step, and then getting in and out of a chair using only one leg. Those are three great places where we can continue to cement our independence and put ourselves in a position where we have efficiency with our body. The more efficient with our body is, the more likely we are to move, less likely to have fatigue, and less likely to be doing that 1 rep max. Outside of that, if we're talking about hip health, going back to some of the isometric tolerance tests, can we side plank for a minute? Can we do a Copenhagen plank? Can we do a single leg plank? Can we do single leg bridges? I would say those are all very, very good tissue tolerance tests, getting into a position and holding them for time. And then the two areas that I would highly recommend having some kind of training around that do involve the hip, but really the whole leg as a whole, is to have a hinge and a squat that is a single leg. The hinge is the single leg balance reach. The single leg squat could be a single leg step down, a single leg sit to stand, which is the chair sit that I mentioned, a single leg pistol squat, a single leg skater squat, or any of those variations. Again, don't really require weight. And then if I get to the very, very simple options level where I'm looking solely at range of motion, I'm talking about probably like my shin box series, my 90-90 hip flip series. Internal and external rotation is something a lot of people lose over the lifespan. It's incredibly beneficial to have from a hip health standpoint, and oftentimes provide us exposure to options that we don't often exhibit. If you think a lot of people through the lifespan, we are not as active as we used to be. We are largely getting up and down, and we're moving forward, and that's about it. So having some exposure to rotation, internal and external rotation, especially in a coordinated and synchronized fashion, can be really, really beneficial for people. So hopefully that applies to a lot of people, especially as we are all thinking about what our next years might be and how we can live them to the fullest. Anybody have any questions? All right, I don't see anything in the chat either. So unless I missed something, I appreciate you all being on today. We do have this recorded. You will be in a situation where you'll get a follow-up email, and we will have a couple small things, especially like the hip flip 90-90. And I think there was another thing that I referenced that I would send out as a follow-up. Feel free to tune in. We will be doing a lot more body part specific focus for some of these workshops moving forward, and we'd love to see you.